Good afternoon and welcome back. If you tuned in this morning with Education Minister Diala Robane, we've moved to the top of the government with Premier David Burt. Welcome, Premier Burt.
Hello, how are you?
Well, thank you. Why don't we jump into it because your time is short and don't want to waste it. Why was June 6th chosen as the cutoff point that travelers had to be immunized to avoid a mandatory 14-day quarantine?
What we've moved to in all of our setup is that we're going to everything by epi-weeks. So if you would have watched the presentation on on Saturday evening, where Dr. Daiwan DeRosa and others spoke about how they're managing the pandemic, one of the things we would have heard was the issue when it came to epi-weeks. And so epi-weeks are something, it's every Sunday to Saturday. So what we're doing now is we're making sure that all of our restrictions start on Sundays, any changes starts on Sundays, so it can be matched up with the epi-weeks, which is used for international reporting, which is used for tabulating our statistics and other things. So that's the epidemiological week per se. And so as we're going inside of our phases, we have phase 2 set to start tentatively on May 9th if all metrics are met. And then 4 weeks later is June 6th. It was just picked on those timescales. It was to coincide with the introduction of phase 3 restrictions.
Right. So I know some people have complained that it's about almost 6 weeks, I think, from when you announced it. And if they haven't gotten a vaccine,
exactly 6 weeks.
If they hadn't gotten a vaccine, it's a tight schedule to
Understood. I mean, and the fact is that there will be people who elect to get a vaccine and who don't elect to get a vaccine. But the move was to make sure, certainly we have to give ourselves time to operationalize it as well. So it was thought that 6 weeks would be enough time to make sure that we can operationalize the supervised quarantine program.
Right. Did we look at what other countries had done now that people are getting vaccinated and immunized and see what from their examples as possible options?
That would be the looking at other countries and their policies towards persons who were immunized or not immunized was not specifically what we were looking at. What we were looking at was countries that have been successful in keeping out variants and limiting local transmission. And the fact is that you can have additional protections at your borders, and that's what we were looking to put in place, additional protections at the border to make that a reality. So one of the things which is interesting, and of course was I think our interaction last night in the questions, was that there have been countries that have eliminated local transmission before the advent of vaccines. So elimination of local transmission is not necessarily vaccine dependent. Vaccines certainly help. Early research and studies saying that it certainly does minimize transmission. As I said on Sunday night, I'm an example. I had a coronavirus infection. I did not pass it on to any of my family, my children, who I'm always with. So it's an example of where the virus can certainly meet up with a dead end. So from that perspective, that's where we're focused on, eliminating local transmission. There's lots of other countries which may have had different policies of which they're looking at, but our focus was the elimination of local transmission and the minimization of risk of the importation of new variants, because we want this change to be the last time it's on. It is so painful having to speak to citizens who cannot go to work, listen to the story of families who are trying to work from home while at the same point in time, dealing with remote learning, as my wife and I are doing here. You might see my children come and run in because they disturb me during meetings all the time if they're fighting or something else. I mean, it's a challenging situation. And what the government is resolved to do is to move past this so we do not have to go back here again. And I think that is the biggest and overriding concern, because for us, we want to get back to focus on governing and to delivering on the changes and progress that is demanded by this country. And we have to get ourselves out of the grips of the global pandemic in order to do so. We really thought we were there last year. We were held up an example of the world, but the coronavirus keeps on changing and we cannot predict the changes of which will happen in the future. So we need to be proactive with the measures of which we're going to take.
Now, I know last night you mentioned India and the situation that's happening there. What role have the variants played in making a stricter policy? I mean, we're facing that. Yeah.
The variants are all about that. So you look what happened with the UK variant was first announced. The UK variant was first announced. We put in additional policies at the border for travelers arriving from who travelers who have been through the UK, where there was a period of mandatory quarantine for 4 days from 0 days for those persons. Of course, people without a pretest, who residents had 8-day quarantine anyhow. But for persons with a pretest, they were given additional 4 days. And so that means that they will be tested 3 times in the space of between 9 and 7 days. And that, for the most part, will catch most items. But then the challenge then further arose, where we saw the importation of the UK variant here, and it did not come from the UK. It came from, I think, through the United States. And so from that perspective, the first change, which I think is important, right, that as of May 2nd, all arriving passengers into the country who are not immunized will be required to quarantine for 4 days. And so for that perspective, that pushes that a little bit longer. Remember, if you're coming in without a pretest, you're going to be in an 8-day quarantine anyways if you're a returning resident. But if you are coming into the country and you are a visitor, say, for instance, who has a pretest but who may be non-immunized, you're going to have that period in time between your negative pretest, your arrival test, and your day 4 clearance, which is between, as I said, 7 and 10 days. So we're continuing on that process, and we think that works and it makes sense. But the controlling of variants is the key point of what this is about, because we can get this local transmission under control. We can reach community protection by having 70% immunization. We can go certain things and all the rest, but if there's still the risk of the importation and the variants, and we're trying to minimize the risk of that as much as we possibly can.
Yeah. Now, I know there are several countries, Anguilla announced within the last week that starting in October, if you're not immunized, you can't come and visit them, but they're not alone in that. And Turks and Caicos recently announced that work permit holders have to be immunized. Did we look at any of those options?
I think what we put in place is as far as we think that we're going to need to go. And it's about protection of the borders. I think that if the government is saying that vaccines are a personal choice, I think it would be bad if we're going to then tell people that, if you're on a work permit, if you don't get vaccinated, you're not going to renew your work permit. And so I'm not going to necessarily comment on what other countries have done. The considerations of which we took into place when we were designing what it is that we were going to do was to look at the countries that were successful in minimizing local transmission. And we can look at examples, whether it be New Zealand, whether it be Australia, whether it be Singapore, whether it be Hong Kong, and those type of things. And the very strict protection of borders are necessary. We know that supervised quarantine is a challenge. I don't like it as much as anyone else. But it's necessary to make sure that we reduce the risk.
Yeah. In the past, we allowed travelers to quarantine in their own homes after the initial phase, even when the COVID modeling, because I remember the pages that we get that were sort of trying to predict how many cases we had, and showed that 1 in 4 would not adhere to the rules. What is different now that makes that no longer acceptable?
Look at the last 2 months, Don. I mean, there is incredible pain inside of our community. I was speaking to one of my MPs earlier today. No premier, no government wants to tell people that they cannot earn money, cannot work, cannot be inside of their business. It is the most painful decision of which you have to make when you get there. And it is not something that we want to do again. And as this has shown us, that it only takes one. And so you can be in home quarantine, and see, people are missing this issue. So I'm thankful that you are letting me answer the question, or asking the question, because home quarantine is an option. Sure, absolutely. But what we are trying to do is to minimize the risk as much as possible. Someone could be on home quarantine for 14 days. We cannot monitor 1,000 people. You fill them with electronic monitoring bracelet and stuff so they don't leave their house. Okay, that's fine. That's not going to stop them from having a party in their house. That's going to stop someone who's, 9 days in, 10 days in, they feel fine, invite some people over to play PlayStation, maybe asymptomatic, and you're sitting inside of a room for 2 hours, and then all of a sudden, you have another cluster that can spread very quickly. These are the things in which we have to be realistic about. And so what our overall overarching policy objective is to not have to re-implement quarantines, to move, not quarantine, restrictions in the populace, talking about sending children home from school, closing businesses, entrepreneurs. We want to allow the local economy to continue to thrive. And so if that means that we have to have additional protection of the borders, if that means that people, tourists who may not be immunized choose to go somewhere else, so be it. But we have to recognize that the pain of which our citizens and our business owners and our students have had to endure. I don't want to do this again.
Okay. Some of the people, because I've gotten at least more than a dozen messages over the last week, who are vaccine hesitant, and they feel like this is going to be a punishment to them for not taking the vaccine, or it's sort of a coercion by the government to try to get them to be vaccinated. How would you respond to that?
I would say that it is not a question of coercion, and people have the option and choice to not do so. The government has been consistent in the fact that vaccination is our personal choice, but we also have to be consistent in the fact that we must recognize that our border is the place where, even if we were to eliminate local transmission, there is always a possibility. Traveling to places where there is community transmission means that things can be picked up anywhere. There's community transmission in the UK, there's community transmission in Canada, there's community transmission in the United States. And until those things happen for a change, then this is the space which we will be. There is one possible change which may happen at some point in time in the future. And there may be countries where mandatory quarantine is not required, but all of our gateways that have direct flights into our island currently have community transmission. That is just something of which we have to recognize. That's the reason why we're placing the mandatory 4-day quarantine now for arriving passengers from all countries and not just the UK, because the UK variant is now the dominant variant inside of the United States. And so we're going to see it. And if another more transmissible variant comes, then that will be the dominant strain as well. So I recognize that it is difficult and understand the cabinet struggle with this. There was much discussion with our caucus colleagues discussing about all these different challenges that we face. And we don't want to cause division. But what we want is the unity that is given from this country when we do not have to worry about the coronavirus. There are people who said, oh, just let it run its course. I mean, there were people who criticized the government for not moving fast enough insofar as the restrictions this time. And then there's people who criticize the government for implementing too many restrictions. There's no win. But I think what we can see is, despite the fact that we had a number of vaccinations amongst the vulnerable population, look at the fact that our death toll doubled in the space of a month. And if we would not have had vaccinations, it could have been much higher. But the thing is that it's clear that the healthcare system, even with the amount of vaccinations of which we had, was able to be under stress. And when you talk about people in the hospital who are passing away from non-COVID related issues, where their families cannot see them, when you're talking about people who may have had elective surgery or necessary surgery that's been delayed, that impacts the health of our country in the long term. Look at the impacts to our children who have had to be stop and start from school. Remote learning is not as good as in-person learning. And look at the mental stress that has been created for parents and business owners and all the rest. We have to get past this. And that's what the aim and objective of the plan is. It is not about division. It is about making the risk-based decisions to ensure that we do not have to go back through this again.
Now, I know you're not looking to other countries for base Bermuda's policy on, because you can find examples on both sides of the issue. But Greece, for example, they are equating travelers who have proof of antibodies to those that have been immunized. Was this a consideration under the new policy, or why not?
That's a technical question, and I've learned to not answer technical questions. I did watch a little bit of the show on Saturday night. I had a meeting at 8:30, so I only was able to watch the first hour and a half. I had sent a message to make sure, to extend it, because it was such good information that was coming out. But I think the doctor spoke there about the difference between, I'm not going to say passive or active or whatever, because I'm going to get it all wrong, and I'm not trying to give technical advice here at all. But I can just say this: there are people this time around, Don, who have been infected who were infected last time around in November, and so it's not a big thing. So we haven't gotten to those decisions yet, so I don't want to say yay or nay. That might be a consideration in the near future, but that's not where we are currently.
Now, I know you understand this as a parent, but there have been a lot of concerns about children under this new policy. You know, what will happen to children who are traveling with their parents and the parents haven't been immunized, and what are the restrictions with the children traveling? I know, like from before, is whatever the parents were on, the children were on the same scheme. So what's happening going forward June 6th?
And that's what can be expected. As we said, we're going to roll out the full gamut of all of the various items and questions and regulations and how it's going to work and how much it's going to cost and different options that would be available to persons. But on a broad and general term and consensus is that children under the age of 16 cannot be immunized currently. Certainly, we're not going to put children under 16 in a quarantine facility by themselves, and so they would certainly be applied to the rules of their parents. So we're not going to have them in a quarantine facility, but they certainly will most likely be required to quarantine, as there's still that risk.
The earlier you mentioned about trying to clamp down on these travelers and travel from Brazil, India, and South Africa because of the highly dangerous variants originating from these countries. Yet we're not doing the same with the UK, where the B.1.1.7 variant originated. Why not?
I think I answered that already, Don. I think that we had placed in restrictions already insofar as from the UK, and we have not seen the importation of the UK variant from the UK due to restrictions. We may see the identification of it, but because we have an extra period of quarantine to catch persons, then that's there. Because we have to remember, people with a pretest, persons who are not resident, are required to have a pretest. The pretest period was between 5, you take it between a few days in advance. You would then go ahead and apply for that. So when you're talking about, let's say, for instance, you took it 4 days in advance. So 4 days in advance of your flight. So you have a test on 4 days before you fly. You have a test on arrival. And then you have a test 4 days after your arrival, your day 4 test. So you're getting 3 tests in the space of 8 or 9 days, which will catch most infections for personal infections. Now, the fact is that that period is going to be extended, of course, to 14 days, but that policy for the UK is being expanded across the board. And so, as you see, we're gradually increasing. So it's not a question of we are ignoring those other places, but the fact is that there are flights to Bermuda from Brazil. That happens, private jet flights, they do happen. So people are like, well, there's no flights. I'm like, that's not entirely true. There are flights that will come from South Africa, which are private jet flights. And so we're working through that process to ensure that we have that additional protection for the possible importation of certainly the P1 variant, the B.1.3.5, and the Indian variant, which we don't have. There's countries in the Caribbean now that have the P1 variant there. I saw something from Trinidad where they had multiple confirmed cases of the P1 variant, which is the one from Brazil. I don't want that here. And so we're just going to have to be proactive, and come 5 and a little bit of weeks, then there's going to be even more protection.
Okay. Maybe I should have phrased the question a little bit different. The people from these countries are going to have to wait 14 days when they'll have to quarantine for 14. So why don't people from the UK will also have to quarantine for 14 days?
I think I answered that question already. We're not there. That's not the policy that we have right now.
Okay. I've had several people talk to me. They would prefer to get the AstraZeneca vaccine rather than the Pfizer, and they're willing to get a vaccine, but they're just not willing to get the Pfizer one because it's mRNA. And why can't they go ahead and get that now?
They can. They certainly can ask for it. We are offering both. The main one which we're offering is the Pfizer vaccine, which we're going through. But I do believe there's the option if they call 444-2498, the help line. I'm not entirely certain if the stocks are either at KMH or at the walk-in vaccination center, and I do believe that some doctors may have been given the AstraZeneca vaccine to give to their patients. If that's not happened yet, that is planned to happen, but certainly there is the option of the AstraZeneca vaccine. So that is available. I know there's some people who would prefer to take AstraZeneca over that, and we do have that which was supplied by COVAX. But the one thing that I would always say is that the best vaccine is the vaccine that is offered to you. And so if you decide to take a vaccine, these are all approved vaccines. The medical agencies have said the benefits far outweigh the risks. There is certainly protection. They've all been rated as highly efficacious in preventing coronavirus disease, which of course everyone knows the difference between a coronavirus infection and coronavirus disease. As lots of conversations happen after my diagnosis, but they have been proven effective in the prevention of coronavirus disease. And I think that it's important to note that it's important to note that we don't have anyone in hospital who has suffered from the coronavirus, who was admitted to hospital, who was fully immunized. And so I think that it's showing its efficacy in real world situations has in many jurisdictions around the world.
You phrase that very specifically, admitted to hospital. Has there been anybody that's already in hospital who's been immunized? That
I'm not trying to parse words. That would be a question that would be better directed to the hospital. I'm not going to. I've gotten in a lot of trouble from attempting to, try to estimate an answer from things that I don't know. I don't know specifically, but if Dr. Miller says that no one who's been admitted to hospital has been fully immunized, and my assumption is that but on the specific question which you're asking, I have no reason to believe that is that the case or not the case, but it's certainly a question that could be asked towards the hospital.
All right. Now, I know you've got a lot of meetings scheduled today, so I just wanted to.
Oh, no problem. We have half an hour.
Oh, half hour. Okay, great. So there are some people that, again, when signing the petition for the vaccine, it states the person's taking it voluntarily, and again, going back to the quarantine, but they feel like, how can it be voluntary if you're doing it with the threat of having to be under quarantine for 14 days?
It's not the question of a threat. It's the question of it's necessary to do to protect our borders, to protect this country, to protect our students in school, to protect our small business owners from the ability to earn a living, to protect individuals from being able to live a life free of restrictions. I know it's hard, but governing in a once-in-a-century pandemic is not easy. And I would sincerely hope that the Bermudian public would recognize that these are difficult decisions to grapple with. And so at the point, there's many other considerations of which were made. Some of the considerations you spoke about, which you've already addressed, the issues of home quarantine, et cetera. We are trying to minimize the risk as much as possible. And that's the direction of which we are trying to get to. So it's not attempting to try to be punitive in any way, shape, or form. It is talking about the fact that as a country, we have to move beyond this pandemic. We are fortunate to live in an island where we can efficiently and easily protect our borders. We're going to put these protections at the border while we work to minimize and eliminate local transmission so that we can move beyond the pandemic. And there's examples of countries that have done that. And I think that it's something that we want to aspire to. We've tried it the other way. We've done it already. Understand, we have tried it. We've tried it with being one of the most tested countries in the world. And even those measures don't work. We've seen that, we understand it, and we have to learn from the lessons of the past. So I recognize the anger. I recognize the anxiety. I don't like a lot of the decisions of which we are challenged to make in leadership, but we have to look out for the total interest of the country. And I will say it until I'm blue in the face. I do not want to tell students they have to stay home anymore. Entrepreneurs who've poured their savings into their business to watch those savings dwindle, for employees who want to work, for people who want to provide for their families and do services. I don't want us to have to go back to the place where in order to save our health system from collapsing and an overflow at the hospital that we have to, to take these measures.
Now, I know there's a tightrope to walk between those people who are really pro-vaccine and those who are vaccine hesitant.
I don't think there's a tightrope, Don. I don't. I'm trying to get to a place where we're not doing this whole division thing. I mean, it's difficult, yes, but I think whether you are pro-vaccine, anti-vaccine, pro-restriction, anti-restriction, you recognize the government has to make rules which are best for the entire country.
Mhm.
And every one of the people inside of those perspectives agree and want us to be past this so we don't have any restrictions. And that's where we're trying to get to.
Right. I had somebody ask me to ask you that if they're in the hospital as a patient, do they have a right not to be treated by people who haven't been vaccinated?
That's a good question. I think you posed that last night to Dr. Miller. I think Dr. Miller will be the one to ask that question. And you know that presents some really difficult ethical issues. And so the government has taken a position, and the position is that we are not going to require any person to take a vaccine. We are going to do protect our borders, and we're going to do as much education as possible. But there are situations just like that, which you're talking about the hospital, where prevent some really difficult challenges and choices. And so we're at the position of where we are right now. And that position may change at some point in time in the future when we're talking about a place at the hospital, but that'll be for something for Bermuda Hospitals Board. Right now, the fact is that these are authorized for emergency use. And so there's not going to be any type of, forcing someone to take these vaccines. It's difficult. I fear. I don't want to say fear. I accept how difficult it must be for the team at the Bermuda Hospitals Board to manage the situation with staff and otherwise. I recognize with patients who may be like, oh my goodness, how am I being treated by, someone? But I do know that the hospital has really good infection control. And so that's the one thing of which you can talk about. And we have, everyone is in their own room and, they do a good job of sanitizing and fitting N95 masks and doing those things. So I think that for the most part, things are okay, but can they be better? Absolutely. They can be better.
Last question, and then I'll let you have a say. The CDC is coming out with, it seems like every other week, with more lessening of restrictions for people who've been immunized, as far as not having to wear masks and lots of different scenarios. I did have somebody pose to me today, like, if Bermuda goes that same route, they're worried that them being required to wear a mask will then their privacy will be invaded, because they'll be shown by wearing a mask that they haven't had the vaccine, whereas the non-vaccinated or the vaccinated person can take it off.
Mm-hmm. Here's what I'll say broadly about the CDC. I would say that it is good that our neighbors in the United States have agencies that are putting together regulations which are based on science. It is not necessarily the government's policy to rely on the CDC, but we're certainly going to be looking at the things which we're putting out. I think what the CMO had said yesterday is they're going to be reviewing those things. We're discussing them. I know that we have a meeting with the health teams tomorrow where we'll be discussing those things to see what changes we can put into place. But as divided as we are, I'm trying not to get to the place where, we're going to say, oh, you're immunized, you can get this, but you're not, you can get that. It's difficult, and all of these things are difficult. So we have the differences at the border for treatment, because that's an actual risk of inward transmission. And if we can, or imported transmission, if we can eliminate local transmission, there's not going to be the need for those type of differences here in Bermuda. And so that's the direction of where we're trying to go. We'll go ahead and look at what the CDC says. And certainly take a look there. And I think where we can get to is a place of issuing guidance for people to understand. So, May 9th is the end of the projected end of the ban of mixing of households. Does that mean that 50 people should run into a house and stay each other next to masks and all the rest? No, that's unwise, because there could be one person there, and then you've got another outbreak. So I think it might be helpful to give things in a small measure of times. You also have to trust people to make the decisions for themselves. And I think what the government can do with the information which we're providing on the vaccine and the information in which we're providing in other ways and other avenues, that we can give people the tools to certainly make their own decisions. We can let people know what is safe, what is not safe, what you should do, what you shouldn't do, and hope and trust citizens to follow that advice. But my most important thing is I don't want to be having a Burt News and Views with Don Burgess on April 28th, 2022, discussing the coronavirus. I don't think, I want to be in a Wednesday of April, children in school, businesses wide open, everyone working and flourishing, sports activity taking place all throughout the island, all that type of stuff, which we were so used and accustomed to happen again. And there are countries who have been successful in eliminating local transmission, some of them through an aggressive vaccination program, such as Gibraltar, some of them through an aggressive border control program, such as New Zealand. We are going to be, there in the middle, and we're going to continue our work. And I have every confidence that the country will be able to move beyond the pandemic, and every confidence that Bermuda again will be able to be an example.
Yeah, that's probably a good spot to end it as an example.
No problem. Thank you very much, Don, and thank you to your listening audience. I sincerely hope that this was informative.
It was. Appreciate your time. I know you've got a busy schedule, and on behalf of Burt News, we want to thank everybody who tuned in, and especially the Premier, who is here to answer a lot more questions, rapidly firing, getting them done. So as normal, have a beautiful afternoon.